are the main objectives of your ecosystem?
Okay, so at a more macro level is to raise the excellence and the exchange of ideas and actions of the Portuguese health ecosystem in an international context. It is attempted to be an agile ecosystem with concrete actions and relevant projection, of course, in the media. So some of those actions are to encourage and support knowledge generation in a sector that intersects politics, technology, and innovation. Also to enable policy makers to take the pulse of the demands and needs of health ecosystem professionals in Portugal, and also for the creation of mementos like events, seminars, workshops, and also digital tools like microsites, webinars, distance learning for the sharing and discussing of ideas regarding health issues.
Fantastic, fantastic, Pedro. And tell me, can you have anything else in relations to the intercompany dynamics that you want to create?
Yes, so that is also one of the main goals, and to create an intercompany dynamic that allows knowledge and exchange of ideas, of course, for the increase of the business around the health area, as well as sharing experience in the internationalization of products and service. May I add also that one of the goals is to share international best practice with the various stakeholders and provide information, general information on European health policy and general guidelines. Also, least but not least, put Portuguese companies on the radar of possible investors and make them more competitive, of course.
Okay, fantastic. Thank you very much, Pedro.
So, Paulo, who are the key stakeholders of Digital Health Portugal ecosystem?
Pedro, Digital Health Portugal unites a number of stakeholders that are very diverse in nature. In the sense that you have a free membership, so any entity that has a stake in digital health can become a member. And these, of course, include the Portuguese Ministry of Healthcare organizations, even municipalities that would be interested to implement digital healthcare projects, patient associations, healthcare companies such as pharma, hospitals, clinics from the private sector as well, private and public research and development centers, universities and schools, and last but not least, technology providers, including the startups and SMEs that are already operating in the digital health ecosystem.
Okay, that sounds good. Thank you. Thank you very much.
Pedro, can I ask you one more question then, the last one?
Yes, of course.
Okay, so why did you join the ESHA Alliance network of ecosystems?
Well, mainly because of their prestige. Also, and for us is very important in Portugal, the international scale. Also, one interesting thing is the diversity of the profiles of its own members, and also the conditions of membership. So those are the main reasons for us to join the ESHA Alliance network.
Thank you so much.
Okay, Paulo, can you tell me who is missing from your ecosystem in terms of stakeholders?
Well, the greater slice of time will now be invested in finding more technological companies with supply services in the area of health, greater awareness also among policymakers, and of course, the media and communication channels. We expect to hold more events of hybrid nature to attract potential investors and to other anchor entities such as research and development centers, universities, and large multinational companies with presence in Portugal.
Okay, thank you. Thank you very much.
Pedro, can you tell me which ecosystems are you looking to collaborate with?
Yes, of course. So preferably we would like to have European or to meet more European ecosystems. Some of them with whom Portugal has a closer and historical relationship, and whose markets are a priority for the internationalization of some of the Portuguese companies. So we are talking about Europe, we are talking about Latin America, we are talking about Africa, and also India, because it's one of the priorities for the 2021 Portuguese presidency of the European Union.
Okay, Pedro, thank you so much.